The disparities are that African Americans, we think genetically, have a higher incidence of multiple myeloma. We're still trying to work on why those disparities exist, and that people of Asian descent are much less likely to get myeloma. About 20 years ago, when our treatment options were limited, there was really no disparity. People, regardless of ethnicity, did very poor with myeloma. And just like you mentioned, in the past 10 years, in the past 10 years, the survival of myeloma has dramatically increased, but has increased disproportionately for those of ethnicity having access to some of the drugs that have made this remarkable process, and also access to healthcare providers that specialize in multiple myeloma. It has become incredibly complex. In order to have those fantastic outcomes, there's been a lot of research, and the disease has gone from having 2 therapies that worked only 30% of the time to now at least 24 different treatments, that with the baseline being that it has to work, 80, 90% of people. But to navigate all of that complexity is very difficult, and which is why it's so critical to obtain second opinions with myeloma, because so much has changed so rapidly. And sometimes the community physicians, with them having only 2% of their patients being myeloma, it's hard for them to engage all those changes and make decision making with their patients.